Hi everyone, Dr. Leigh here, and tonight we are going to be talking all about how do I manage my dog's sore ears. Now, I really wanted to talk to you about this because over the last probably month, I have been inundated with so many people doing online consults for people that have dogs and cats. And actually, I did have a rabbit, and I've also had a horse that had problems with their ears. So I thought it would be a really good idea to actually discuss this with everybody, because it's really, really common. One of the biggest problems with giving these types of advice online is what I say tonight is general in nature. So every animal is completely different. So, and in particular with ears. Now, ear problems can be caused by a multitude of things. So it's really important that you get a very good diagnosis. So what I talk about tonight is in general terms, but definitely we can work on it together, and even in an online consult we can definitely help you, guide you through the whole process and advise on some facts that you might need to and things that you might try at home that might help matters. What we're going to talk about tonight is a little bit about why our dogs get sore ears, the process of what a vet needs to do to actually diagnose those properly, and the treatment that they give, but most importantly, what your role as a owner is to ensure that whether it's your dog or it's your cat or it's your horse or rabbit, that the ear problem doesn't keep on coming back, because ears are one of those things that is super, super painful, and we don't like it, and it can cause so much disruption to not just your home life with your pets or your horses, but the actual animal. And in some ways, like some of the cases that we see, we really start to wonder, is this actually a case of neglect? Because some of these animals can have very, very bad and painful ears. So, if you haven't met me before, I'm Dr. Leigh, and I'm the founder and managing veterinarian of Your Vet Online, which is Australia's only 24/7 online veterinary health consultancy service. And so what that means is that you can get access to veterinary advice immediately, because we don't do appointments, and 24 hours a day. So, yep, you'll get one of our vets, even if it's in the middle of the night or on a public holiday. We're always available to help you. So we're the only ones that do that in Australia. So if you've ever got any questions and you're struggling, we can definitely help. And there's a lot of things that we can help you with. We can even give prescriptions with certain things if warranted. I'll have to say, ear stuff, generally not. We do not generally do ear prescriptions for antibiotics, but for most other things that we can definitely help you with. So if you are keen, make sure you go and sign up to our newsletter. That's always good for getting a little tidbits about animal health things. It alerts you when we've also got these sessions on and these tutorials on. And I always give a product that I really love. I talk about my favorite products and all those sorts of things. So if you're keen, make sure you head over to the website and sign up for our weekly newsletter. Okay, let's start off with what some of the signs are that our pet might have, or our horse might have, sore ears. So tonight I'm just going to be talking in general terms. I might say cat, I might say dog, but all the animals are pretty much the same, because they do show similar signs that they might have a problem. And a lot of the times it can be actually quite hard to pick up the subtle signs that your pet or your horse might have a problem right at the beginning. Often, there might be a little bit of a subtle shift away. They might duck a little bit. They might avoid you patting them on the head. Perhaps if you go to lift up and give them a bit of a rub on the ears, they avoid it. And that could be very, very subtle. Not all these animals, sometimes they just move away from you. Sometimes they just rub you might notice them rubbing their ears on a fence post a little bit more often, the leg of a chair, that sort of thing. So sometimes you see them rubbing, sometimes you see them scratching, you might see them shaking their head quite a bit. You know, there's all those little subtle signs that you might see. You also might notice that the ear itself is really red and inflamed. There could be a black discharge. There could be just like some other sorts of discharges, like it could be creamy coloured, it could be really smelly, or there might not be any smell at all. So all those sorts of things are signs, of course, that your dog has an ear, or your cat, or your horse has an ear problem. So I've just got a picture here. This is a German Shepherd, actually, that's got a sore ear. And as we can see here, you know, it looks, there's not a lot of redness, but it is probably a little bit more red than it would usually be. But there's that black discharge. Now, this doesn't look particularly bad like some ears can get. So, but it's still bad enough that we need to catch this now before it gets worse. Sorry. Here's a picture of a cat with sore ear. You can see that there's a lot of discharge in there, and it looks like it's the skin of the inside of the ear is actually starting to get quite raw and ulcerated. And so that tells us that there is something very nasty going on. So definitely needs to get checked out so that we make sure that there's nothing that we get on top of this, because if we leave these problems, these animals become highly anxious, and it becomes a behavioral issue as much as anything else. And we all know, that when you see some of these, animals, they might avoid you like the plague and become so scared to come into the vet clinic. And that's another problem, because they just feel like, their ears are the source of so much pain. With those pictures that we just saw there, we call that otitis externa. So that's all on the outside part of the ear, going down to where the eardrum is. And we call that the eardrum, the tympanic membrane. Now, if the infection breaks that tympanic membrane and gets into the inner ear area, we'll call that inner ear problems. And that's when you might notice things like trouble eating. So they might have trouble chewing on a particular side. You might see them a bit wobbly with their balance. They're all over the place a little bit. They really might be putting their head on the side. And in really bad cases, because our nerves for our face are all in that sort of inner ear region, you might see problems with the eyelid droop, the mouth might droop, the tongue might hang out, depending on if there's a nerve involvement too. So these can get quite nasty. So it's always a good idea that we never leave these for too long, because they can develop into a bad situation. So I don't think I can stress this enough. Ears are so painful. If you cast your mind back to when you were a child, I think we've all probably had an earache at some stage. Now, what's going on with our ears is very similar to what's going on with our dog's ears, or our cat's ears, or our horse's ears, or our rabbit's ears. So please, people, even if you think it doesn't look that bad, it can be. And absolutely every single ear problem is painful. Some animals are just like humans, just a little bit more stoic than others. So you might think they're okay, but I just have to say that they are not. Now, some breeds are far more predisposed to ear problems than others. So you probably already know this. So when we're talking about dogs, we talk about the dogs that have got pendulous ears, you know, those ears that flop down and cover, you know, they flop down on the head. And so those are dogs like your Labrador, your Golden Retriever, those sort of animals. Now, they are quite prone to these problems. You've got your dogs that have really hairy ears, and so you might have your poodles or any of the oodle type breeds. They often have really like a high predisposition to getting ear problems. And then you have your dogs that often have problems with allergies. And so these are the dogs that the ears are showing you that there is actually a problem elsewhere, such as an allergy. So that could be an allergy that is either something related to the environment, or it could be a food-related allergy. And we see this most commonly in our staffies and our bulldogs, so whether they're French bulldogs, English bulldogs, any of those sorts of breeds, they are in our German shepherds. We often see allergy-related problems with ears related to an allergy in those types of breeds. So it's important to recognise and just consider what breed of dog you have and what they might be prone to getting. So when we talk about dogs with pendulous ears like your Labrador and your Retriever, I often see these problems with those dogs, especially dogs who love swimming. And so it might be that they get in the water and they're hooning around and they love it, and those ears are flopping down on them, but they don't ever dry out. So remember that any sort of moisture, and this goes for any skin problem at all, it lessens defense of our skin, because our skin is the biggest organ. It stops infections getting in. But if we keep it moist for long enough, like consider having, like when you have a sticking plaster on your skin, when you leave that on for a very long time, the skin gets really weak and yucky and white, and it can actually, if you leave it on a really long time, it actually might thin out and be prone to being broken. So any sort of break in the skin will let bugs and everything in. So that's generally the problem when we see dogs such as those ones like the Labradors, the Retrievers, those sorts of dogs that get have the pendulous ears, and then they do a lot of swimming and get the ear problems from that. Even though they haven't got pendulous ears, I do see this a lot with our German Shepherds too, but again, they're very, very prone to allergies. The other thing is when we've got dogs that have very hairy ears, there's a bit of a movement over the past few years that we should pluck ears. I just want to tell you all now, please do not let anybody pluck your dog's ears. The only time we pluck ears is when the veterinarian is actually got the animal under sedation or under a general anaesthetic and is actually treating an ear infection, because then we actually have to remove the muck. And in the process of removing muck, we need to remove any hair that's in there. But healthy ears should never be plucked. It was old-fashioned. Times have changed. We now realise that that is a massive no-no. So please do not let your groomers pluck ears. Send them to me if they've got a question. I'll put them on the straight and narrow that we do not pluck ears anymore. I'll just say it's one of those things that we all were told. I remember being told as a student that we should do that. Now all the expert dermatologist specialists out there say that it's a no-no. So whatever you do, do not pluck ears. So this is where we go. Like, we basically, the first time you've found an ear problem, or even if it's the second time or third time, like Lisa or Tanea have saying that she keeps on getting infections. So we'll talk about prevention shortly, but you've found your problem and you want to do something about it. You might have noticed that perhaps they're just not moving their head around very well, they're avoiding you touching them, or maybe the ear looks a little bit red, maybe there's a discharge. So what do you need to do? I think the most important thing, as I've already stated, is these ears are painful. So there isn't much we can do at home. Well, let me recategorize that. If you don't have access to veterinary care and it's in the middle of the night or it's over the long weekend or something like that, or you live rurally, we can definitely help you with an online consult and advise you on some medications you can give for pain for your particular animal while you wait for the vet to open or to be able to get to a vet when they're open. So we can definitely help you with that. But just remember, with all of these ear problems, you actually do need to get your pet to the vet, not just because of the pain. Well, the pain is the big one, but we need to get a diagnosis on why this is causing a problem. Because as I said, we've got a couple of problems going on here. Every ear infection or ear problem that we see is always caused by something else. Yes, you might have the odd one that could be something like a stick or maybe a tumor or an insect, but those are few and far between. And that's a different category altogether, because basically you remove whatever's going on in there and then of course they'll come right. The conditions that we're talking about here are those ear infections that are generally caused either from an allergy or from too much moisture. And usually there is a problem with the whole animal. I say the whole animal, and I don't mean that in a bad, like your animal's sick or anything, but usually it's a systemic problem that is actually causing the issues in the ears. So what we want to do is we want to treat the ear, but at the same time we want to treat the whole animal. So that's why you need to see the vet, because we need to get to the bottom of it. So once you've worked out that your dog or your cat or your horse has actually got sore ears, we do need to get to the vet. And the biggest problem we find as vets is that these pets or horses are really head shy and are really, really painful. So then it really can be quite difficult for us to examine them properly. And one of the most important things that we need to do when we're examining them is looking down their ear with an otoscope and checking to make sure, one, we want to make sure that we can see the tympanic membrane. And two, we want to make sure that we see whether there's anything down there, like sticks, insects, a tumor, anything like that. But also, we want to take samples to make sure that we actually know what we're treating. Now, sometimes you just cannot do that in a pet or a horse that has got a sore and painful ear. So unfortunately for us, that actually means that we often have to use sedation, and we have to, and for some, we might even need to do a general anesthetic. And the choice between the two really just depends on the severity of the potential problem and basically how amenable your animal is, because sometimes it is just far easier to anesthetize them totally, get in there and give them a really good clean. Now, before we actually get onto the cleaning, what we always do is we make sure we get we do ear cytology. So ear cytology is where we take a swab and we go into the ear and we take a little sample from all that muck that's in there and we lay it on a slide. So if we pretend, I'll just move that off. If we pretend the phone is a slide, we get the swab and we make lines on the slide like so, and then we do what we call a gram stain. And what that does is it shows us what cells are present. So what we're looking for is we're looking to see whether whether we've got bacteria, whether we've got yeasts, and we're looking for mites as well. So because some of our animals, especially our horses, our cats, and our rabbits, often have problems with parasites. So we need to rule out that that isn't a problem down there. When we do this, we're also looking at the type of bacteria. Is it a what we call a cockeye? Is it a rod? Is it a gram positive? Is it a gram negative? And that helps us decide exactly what kind of treatment that we're going to put down those ears, because a lot of treatments actually do not require antibiotics. And what we want to do is we want to be very good ambassadors for antibiotics and not give too many and cause resistance problems. When you go to the vet or you ring up your vet and say, I want some more antibiotics for my dog's ear infections, it actually might not need antibiotics, because one of the most common infections that we find is actually Malassezia, and that is a yeast or a fungus, and so it actually doesn't need antibiotics at all. And an antifungal agent might be perfect and good enough to deal with it. There is method in the madness when a lot of vets refuse to just hand over medications. It's just like why you can't get medications without a doctor's visit for yourself. We need to examine, we need to do a cytology slide, and we need to make a diagnosis of what's actually going on in that ear to be able to treat it properly. And that sort of brings us on to some of the treatments that we give. So your veterinarian has found the problem, they've decided to use a medication, and generally speaking, they will give you a medication that's exactly to kill either the yeast or the bacteria. And sometimes it's a combination product, sometimes it's just a single product. And all the time, your vet is going to actually give medications to actually help with the inflammatory response. So they're going to give your pet prednisone, and that's usually either in the air preparation or as an oral, because remember, we want to stop that pain. The other thing is that when we put these animals under sedation or anesthesia to clean out the ears, and this goes for horses too, we always give them a really good flush. And we have to be careful too, because the tympanic membrane is a very fine membrane, and we don't want to be poking in there really hard, and we also don't want to be scraping off any of the skin that's inside that ear canal, because if we do that, then we're actually going to exacerbate the problem. So it's a very delicate procedure. We've got to take a great amount of care, and of course it's so much easier to do that if the horse is sedated or the rabbit's anesthetized or whatever. So that's one of the big reasons for that. This is where you guys come in, because when we're doing the treatments, the biggest problem with why we see recurring ear problems is because a lot of people aren't doing the medications properly. And I know I hate saying that, and it's not placing blame, because I tell you, I know how hard it is to give medications to a sore animal, especially if you've got a dog that's a bit bitey, or you've got a horse that thinks it's a giraffe. These things can be really, really tough. But what I want you to all remember is when your veterinarian gives you these medications, you must use a syringe with you want to get one that's tells you how much is on the syringe, and each ear in a normal size dog, sort of a 18 kg dog, takes 1 ml of ear antibiotic to actually fill that whole canal. So we want to cover that whole canal. So if an 18 kg dog needs 1 ml, then we're probably looking at about 0.3 to point for a cat, and we can sort of change it based on sort of size. But it's really important, guys, if we don't treat these animals with the product the way it was intended for as long as your vet tells you to do, then we're in trouble. Now, you've probably heard every vet will say, come back in 2 weeks and keep using the product for the next 2 weeks and then come back and see you. And I can guarantee you that so many people don't do that, because the ear looks great. It's healed. We don't need to go back. It's all gone. But is it? That's the problem. And unfortunately, when we're doing these medications, a lot of them we actually have to treat for a good 7 days post a clear cytology. So that means that when we do that little test, now often we don't need to put the animal under anesthetic or sedation for the next test because the ears are a lot better and they're not as painful, but we still take another slide, test that, do the gram stain, and then we're going to be looking again. And if we see nothing on that slide, that's great, but we still need to treat for a few further 7 days for most products. Now, sometimes it does differ for different protocols. For the vast majority, that's the case. Please, it's so important. And if it hasn't, if you've gone back in 2 weeks and there's still lots of bacteria there, there's still yeast there, well, there's something going on. And then we can work out exactly what that is, and we can take appropriate action. And that may be changing medication. It may be that you come into the clinic every day for somebody else to apply the medication if it's a bit difficult, or we try a different kind of syringe to help you. There's so many ways that we can help you deal with your pets so that you get the right basically you get the right result, because it can be really hard, and we don't want you to fail at this, because failing basically it creates anxious animals, and we don't want that to happen. So that gets onto our prevention thing. And I think the key here is to make sure that when our pets have had if they've had a case and you've taken them to the vet for their treatment, you must follow all the instructions that your veterinarian gives you to the letter. Correct amount of medication in the ear is absolutely crucial, because I suspect a lot of these problems are underdosing with the medication. So if we're not putting enough solution in that ear and it's not covering that whole ear canal, how can we treat the problem? Number 2, we're basically a lot of people are over cleaning their dog's ears. Now, there are some good products available for cleaning at home, and I'm just going to find these. So there's an example of a couple of products that you can purchase from your vet. Like, you don't need to have a script for these. But the thing is, you don't want to be cleaning ears all the time. If you, and when I say cleaning ears with product. Basically, you're going to get cotton wool or some swabs and put some gloves on and just some saline, and you can clean your dog's or cat's ears or your horse's ears very gently. You know, we don't want to be poking anything down their ears that you risk harming the tympanic membrane if you go too far. But you definitely want to keep that clean and healthy. You don't want to be plucking, so we definitely don't want to do that. But if your dog has gone out to the beach and they're covered in sand and they've got sand all through there, you're not going to pluck necessarily, but you can use water to try and get some of that sand out and just clean it up. As far as using the ear cleaners and things like that, generally speaking, healthy ears shouldn't require them to be used too often. Again, do what your vet says, because they're seeing your animal, but in general, it might only require an ear cleaner very occasionally. The most important thing is actually keeping those ears dry and keeping the skin of your whole animal healthy. And for cats, rabbits, and horses, making sure that they don't get mites, because and that is very easy to prevent, because we have medications that are over the counter that you can give them. So for our cats, you might choose a product like Revolution or Bravecto Plus, something like that. I think the same, any of the ivermectin type products or moxidectin for our horses will do the job. Parasite prevention is relatively easy for you to handle yourselves at home. You can always give us a bell, and we can and get in touch with us, and we can advise even further if you've got a question about that with your specific animal. But as far as cleaning goes, less is more in a lot of cases. So you don't want to be stripping all those healthy oils. Actually, that's something that's really important. Like when we're talking about anything to do with skin, so last week we talked about anal gland problems and skin fold problems. This week, it's ear problems. Now, a lot of these things is because our pets have allergies. If allergies or parasites are probably the big two. So we really need to work really hard to be thinking about the things that we do. So we give our pets their parasite control, and we make sure we work out exactly what's causing any allergies. Food allergy is not very common. Generally speaking, it's environmental. However, food allergies really do affect ears very, very badly. So that's something that to be always aware of. So if you've got a problem with your pet and they continually tend to be getting ear problems, it may well be it's a food allergy. So please talk to your vet about that, or talk to us about that on one of our online consults, and we can get you started in the right direction and help you, because there's plenty of things that you can do with that at home. Oh, and I was just going to mention keeping your omega-3 products like your fish oils and giving your pets or your horses an increase in omega-3 can actually really assist with all these types of problems. It really helps with skin problems and allergy problems. So absolutely, if you've got an animal that's you're finding that they're very prone to this sort of problem, omega-3 oil. I really like fish oils. Don't go down the flaxseed oil route or anything like that. Fish oil is the way to go. It has your higher amount of omega-3, and it's not so much omega-6, because omega-6 is a bit more inflammatory, so we don't want to use that. So yeah, basically with your ears, we want to try and do as much, well, touch them as least as possible, because we don't want to be causing too many issues. So when we go back to, let me see here, to Lisa's comment about her dog getting, he's getting an ear infection every few months, and should she wash his ears weekly with epiotic, or does it make them worse? Well, yeah, it's a funny one with that. Like if you've been doing that and they're getting them every few months, well, maybe you're going to have to change something. And like I said before, his issue may actually well be something to do with an overall allergy problem. So I do see this a lot with cavoodles or any of the oodles, and often, yeah, there is something else going on. So it's about getting to the bottom of it. And did she say, yeah, it doesn't say whether it's a yeast or anything like that, but yeah, depending on what is actually causing the problem, we can work out exactly what needs to be done. Okay, so if you're getting ongoing yeast infections, again, it really does sound like that's an allergy type issue. These are usually because of a systemic problem. So yeast is one of those things that, yeah, you can smell it from a mile away, and you've got to deal with the primary cause. Now, remember, there's some really good products out there now. So we're not just talking about putting these dogs on and cats and everything on steroids anymore. We've got products like Cytopoint, we've got products like Apiquel that are really, really good and very, they work so well with less side effects, and so they're a really good option for many people. So I would definitely recommend talking to your veterinarian about any of these products if they think that it's an underlying cause. I think the ears, again, the one thing we haven't had problems with. Oh my gosh, Kylie, I think you've just jinxed yourself. Yeah, that's really good, Tonya. Definitely, we want to be keeping those ears nice and dry. Don't be plucking them. Don't be tempted. Paper towel or a cotton wool, a small piece of cotton wool in your fingers just to get those ears dry after they've been out swimming. It's just like, honestly, it's like I always recommend if you've got a dog with, say, allergies and they go out, you clean their feet, because then they don't gnaw at their feet. You want to remove all those allergens. You want to remove any of the dampness as much as you can. I mean, I know you can't get really, really deep into the ear to remove that moisture, but generally speaking, our ears are, there'll be hair down there for a lot of the animals, and if we keep the environment as clean and as healthy as possible by trying, keeping them dry, then we're not going to be causing these problems nearly as much. Baby wipes. Yeah, I don't really have a problem with baby wipes. I think they're fine. The big thing is that not every animal, just like people, like some might find that it's a little bit, you might have a flare up. So I always say when using any sort of product that you don't, it might be okay, but always just try it on a small place first. So you might, I'll just show you a picture. So you might try it on the, where is it? Da-da. Yeah, so we got this picture here. You might just try it on the outer sort of bit, the pinky bit that you can see there, and not push it too deep, just so that we don't get, you're not going to actually, if it does go red and sore because there's an allergy to that, they're not going to actually make things worse. Because just remember that some animals are allergic to everything, just like some humans. I know I've been allergic to some baby wipes myself. So yeah, the biggest thing I think I can stress here is that when your pet does get an ear infection, it is the most important thing that you can do is actually take them back to the vet and get that recheck. If you don't do that, you're just really asking for problems, because most of the time, we really do need to just make sure that we're killing all those bugs and that we're taking and we're treating those problems for as long as we actually need to, the correct amount of time. Because if we don't, it's just going to keep coming back. And when we're doing this, I think the most important thing is not to over clean. Usually, generally speaking, we don't need to clean, be cleaning the ears at home at all. The vet will clean them out properly the first time. You just have to put the medication in there, and then you don't generally need to clean them much up yourself until after the fact, after you've cleared everything, and then it might be a maintenance clean once in a while. I think sometimes we're so intent on trying to stop these infections that we actually over clean and we remove all the good barriers and things like, that the body produces themselves to protect against all this sort of stuff. So we do have to be very careful. And of course, there are some bugs that are mighty hard to treat. And a lot of those, like one of the ones that comes to mind is Pseudomonas. And we do have problems with resistance to some of these bugs. And so it's really important that we're very careful with what we use and what we follow our veterinarian's advice. Because some of these bugs are also, the drugs that we need to use to kill them are the drugs that we as humans are our last drugs available for some of those really nasty infections like MRSA, strep, staphs, and all that sort of thing. So we do have to be really, really careful with what we do and think of antibiotic stewardship, because we're not making these new antibiotics. So we've got to look after the ones we've got, and we've got to do the right thing by our animals as much as we have to do the right thing for humans. And with as far as that goes and about doing the right thing by our animals, go and have a look at your animal's ears tonight or today or whatever time it is where you are. Just have a look, see if they are fine for you to handle them. If they're a bit unsure about it, maybe they're not very happy and maybe they're painful and maybe they need to be checked out. So if that's the case, then definitely get them looked at and definitely get some pain relief for them, because ears are painful. So I just want to reiterate that because it's so important. And yeah, you have a great one. If you have any questions, make sure you just pop them in the comment section and we'll get to those at some stage. All right then, you have a wonderful evening and we will catch you next week.